Hi, everyone. My name is Carolyn Savage. I'm a respiratory therapist and respiratory educator, today talking about respiratory medications. The benefits of using inhalers or respiratory, which is the most common respiratory medications for your breathing, really focuses on improving quality of life, reducing shortness of breath with physical activities, lessening your cough and opening the airways to move mucus out of the chest much easier. And certainly a biggest focus of the respiratory medications are reducing or preventing breathing flare-ups, emergency room visits, and hospital stays. What you should know about your medication is really the name of your medication, what it's for, how it works ideally, the dose of your medication, and if you're able to, knowing more detail about your medication. So when you're supposed to take it, how to take your medication properly, and potential side effects of your medications. Often keeping a list of your medications and what they're for in your purse or wallet is very important. Classes of medications, when we think about respiratory medications, are really broken into two different areas. One is bronchodilators, which open up the airways. Here on the right is an image of the muscles around the outside of the airways or breathing tubes. And so often the medications, the inhalers, focus on relaxing those muscles as a way to open up or bronchodilate the airways. Corticosteroids focus on the inside of the airways really, and work to reduce swelling inside the breathing tubes. They can be further divided into short-acting inhalers and long-acting inhalers. Short-acting bronchodilators are really known as rescue puffers, emergency inhalers. They are used as needed in order to help in the moment of breathing symptoms, to help improve the symptom and ease the breathing. They work quickly. They have what we call a fast onset of action and a short duration of effect. So often they start to work within a few minutes, and the effects of keeping those airways open can last 4 to 6 hours. Side effects often could include faster heart rate, shakiness, or dry mouth. Long-acting bronchodilators are really used day to day as a way to keep those airways open long-term. They allow air to pass easier through the lungs by working more slowly, and the duration of effect, how long they last, can be 12 hours to 24 hours. They should never be used as a rescue medication in the moment of bad breathing, but again, used as a way to keep those airways open and prevent breathing flare-ups. Side effects often include dry mouth and shakiness. Inhaled steroids is another class of respiratory medication, used daily, again, as a way to treat the swelling in the airways in order to open those airways up. They work slowly, again, a slow onset of action, long duration of effect. Often the inhalers last 12 to 24 hours. They are never the choice when you're in the moment of bad breathing and should never be used as a rescue inhaler. They just don't work that quickly. Side effects could include thrush and a hoarse voice, so a yeast infection in the mouth. So often after using the steroids, people will rinse their mouth and rinse and spit after using these inhalers. Combination inhalers are just what that means. 2 different medications put into one puffer. So they can be 2 different bronchodilators. The puffers, inhalers could have a bronchodilator and a steroid, or there is one inhaler out there with more to come with 3 different inhalers in one device. They all work slowly to reduce the breathing flare-ups, minimize the day-to-day symptoms of coughing and shortness of breath, and in that way improve quality of life. Side effects could include a sore throat, hoarse voice, runny nose, and cough. Sometimes after using some inhalers, people will cough for different reasons. Thrush or yeast infection in that mouth, and shakiness. Different techniques are needed for the different styles of puffers out there. So each company that creates respiratory medications have created their own device on how to deliver the medication into the airways. Studies have shown that over time, most people forget how to take their inhalers properly and bad habits form. Do be sure you know how to use your inhaler properly and have a proper technique.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
So that's certainly an example of how, without realizing it, we may not be taking our inhalers as it's prescribed. Please ask for help if you're not sure you're getting the medication into the airways properly. So there are other medications for the respiratory system, which may be added in the moment of a breathing flare-up and used short-term or used long-term at different variations. So there are short-term medications can include the antibiotics and prednisone. Longer-term medications may be a pill called Daxis or some of the new biologic medications which focus on different aspects of the respiratory system as a big way to try and prevent breathing flare-ups. Sometimes people are on antibiotics as well long-term, depending on the condition and what the goal is for the respiratory system. Usually these extra medications are prescribed by specialists such as respirologists. As well, some sinus treatments or medications for acid reflux may also be prescribed, as they can certainly mimic breathing symptoms, but not necessarily mean that the lungs are needing the treatment. So do talk to your main provider for more information if you think that's the case for you. Oxygen is also considered a drug medication for the respiratory system. We breathe in 21% of oxygen in the environment that we're in. And this is the body's fuel for the cells, the brain, the heart, the muscles, the organs. We need that in order to live and function. If your body is not getting enough oxygen, supplemental or extra oxygen might be needed in order to improve symptoms and allow you to stay more active and with fewer symptoms. Being short of breath does not necessarily mean that you are not getting enough oxygen and you need extra oxygen. Oxygen or O2 therapy is considered a medication that has best effects when it's used continuously for at least 15 hours per day. So not necessarily putting it on or off when you're feeling shortness of breath or removing it when you're feeling well. It is not addictive. And again, the body needs this oxygen to survive. Oxygen may improve shortness of breath, but it cannot change the lung function. It doesn't change the damage that may be in the airways. It may improve, however, the feeling of fatigue and low energy. It can improve the exercise tolerance. So having that extra supplemental oxygen will allow you to hopefully be more active and sleep better. And it can improve heart function in that the heart isn't searching for that oxygen, low oxygen that's needed for the body to survive. On the bottom right is a home oxygen monitor that's placed on the finger and can allow people to measure what their oxygen levels are at home in a quick and simple way. Hypoxia really means low oxygen levels in the body and can be serious if it's gone untreated. People may experience low energy, really significant shortness of breath if the oxygen levels are low, confusion, poor concentration, poor memory, waking up very short of breath from sleep. Other symptoms may include a bluish tinge in the fingers or lips, which is really a serious sign that the emergency room is needed. And other symptoms may include swelling of the legs or symptoms of heart failure. So if you're noticing any persistent symptoms, please do talk with your main health provider or go to the emergency room if you notice these symptoms. And oxygen comes in various devices. Some is humidified, some are portable, and others are larger and more stationary. It can be sometimes dry, so some side effects may be dry nose. And sometimes, even though people qualify for oxygen, it may not be set up in the home if it's deemed to be a risk for patient safety. And often that includes people who smoke, or if there are other smokers in the home where the oxygen will be applied. So it's a process in order to get supplemental oxygen, and the home care company will often do those assessments. If you have any questions about anything that was covered in this presentation, please reach out to the Connect Well Lung Health Program for more information, respiratory educator, or your main health provider. I hope you enjoyed this presentation.